So, one of our clinical parts of chapter 9, articulations, is arthritis. And there are actually a few different types that we'll go over. So, generally speaking, what is arthritis? Arth means joint, and itis means inflammation. So, in all of these cases, you have inflamed joints. But the cause of the arthritis differs in all of them, and the people who are most likely to have these forms of arthritis also differ. Osteoarthritis is the most common form of arthritis. It is simply wear and tear, so overuse of the joint. Over here, this little diagram is showing you those are actually chunks of cartilage you can see there. So articular cartilage starts rubbing up against each other, which is not ideal. So synovial fluid doesn't always provide a perfect cushion. And then over time and use of that joint, that cartilage starts to tear apart. And sometimes you might even have bone contact. It can be quite painful. Wear and tear means it's much more common in elderly people because they've been around the planet longer and been using their joints longer. Also, people who have some sort of activity they do a lot of. So, for instance, marathon runners, they use their knee joints a lot, and often they develop osteoarthritis eventually as they get older. Second type of arthritis that we're going to learn about is rheumatoid arthritis. So, rheumatoid arthritis is very different cause. Rheumatoid arthritis is an autoimmune disease. We're actually going to cover a few autoimmune diseases in this class, so it's worth defining what we mean by that. Auto means self, immune system, defense against pathogens, but in this case, the immune system is attacking your own body's tissues, which is pretty terrible. So the immune system is getting the wrong message and thinks those tissues are actually pathogens and the immune system is trying to destroy them. A lot of different types of autoimmune diseases out there, and they differ quite a bit in their symptoms because it depends on which tissue is being destroyed. In the case of rheumatoid arthritis, synovial membrane is being attacked by your immune system, and it will cause lots of inflammation and swelling of the joint capsule. After that, you'll get a buildup of like scar tissue. So excess collagen fibers will start to build up in there, which makes it even harder to move your joint. And over time, what can happen is those collagen fibers from the scar tissue can ossify and the joint becomes fused. So that's what's going on down here in this radiograph. This individual, the metacarpal phalangeal joints, have fused, and actually looks like some of the phalangeal joints have also, the interphalangeal joints have started to fuse. It's really terrible what can happen over time, and it develops at a young age. If you're going to have it, it appears as a child. Very different from osteoarthritis. Osteoarthritis is associated with aging and activity. Rheumatoid arthritis, the causes of autoimmune diseases are not always clear, but it's going to appear in a child, and over time, they might need to have their joints intentionally fused. It was preferable to do that clinically so that they could be fused in a position that was more comfortable and functional, because you can see here that's probably not very comfortable and maybe less functional. So sometimes you have no choice but to intentionally fuse joints. Autoimmune diseases, there isn't really a cure. There's various immunosuppression drugs that some individuals can take that might help, but also the trade-off is you might be more susceptible to actual pathogens. Last type of arthritis. Gouty arthritis is buildup of urea in the synovial fluid. So actually you'd have a buildup of urea in the blood plasma, and then that ends up in the synovial fluid. So, because it's synovial fluid is filtered from blood plasma. Urea is a waste product of protein metabolism. Normally, urea is filtered out of your blood plasma by the urinary system. By the way, it can also be in a slightly different form, but basically the same stuff. Uric acid. So those are essentially the same thing for our purposes in this class. Essentially the same thing, waste products of protein metabolism in slightly different states. So what happens to this urea as it builds up in the fluid is it forms these crystals, like mineralized, which is incredibly painful. It's like you've got a rock stuck inside your joint cavity. That is extremely painful, as you can imagine, because that rock is not going to be gentle and cushioning. Again, gouty arthritis is a waste product of protein metabolism in the form of urea. Your urinary system should normally filter that out. If you have excess urea, though, it could end up in synovial fluid. So people who have gouty arthritis often have perhaps some sort of kidney problem. Not always, but that's likely. My dad gets gout because his kidneys are damaged. It generally appears in your big toe. That's the most common spot to see it. And the reason for that is simply gravity. The urea and the crystals are heavier, so they go down. They're more likely to be seen in the joints of your foot at the very bottom. Dealing with gouty arthritis is probably the easiest one to manage of all these forms of arthritis. There are medications. Also, as my dad had to do, dietary changes. He doesn't eat as much protein as he used to in order to avoid getting the gout.